Glaucoma is a disease where the optic nerve gets damaged, and primarily through elevated pressure inside the eye. So over time, the pressure in the eye damages the optic nerve. If the optic nerve gets damaged, the information cannot get from the eyeball to the brain, and it results in patients losing vision, typically from the side first, then eventually to the center. So it's a very scary, silent thief of sight because patients will not notice it till the very end. So it requires them to come in for annual eye exams because the doctor can detect whether or not the patient is developing glaucoma. Once a patient loses their peripheral vision so it affects the center, it does not come back. You lose. Once you've lost it, it's lost forever. So the name of the game is to try to catch it early to try to prevent that from happening. And we're fortunate here to have many different types of equipment which allow us to image the optic nerve, to allow us to see how patients respond if they're losing their field of vision. And we can see through all these different modalities whether or not the optic nerve is being affected in these patients. And if it is, we have ways to treat them through drops, laser beam treatment, and even eye surgery. I was also fortunate to be one of the earliest surgeons in the country to help develop something known as an express shunt. And what that is a little tube that we can actually insert into the eye surgically in the OR, and that tube allows fluid in the eye to escape the eye. And when it does that, it decreases the pressure in the eye. And by decreasing the pressure, it will prevent the optic nerve from getting damaged.